Two members of Congress from Colorado will play a pivotal role in deciding where your taxpayer dollars are spent.
And perhaps more importantly, what should be cut. Republican Gabe Evans and Democrat Diana DeGette sit on a committee that will begin debate tomorrow on the biggest spending cuts in the Republican budget bill. Your political specialist, Sean Boyd, spoke to both lawmakers.
And Sean, their committee oversees Medicaid.
Yeah, a program that provides health care to 1 in 5 Coloradans and would undergo big changes under a plan revealed last night by the chair of the House Energy and Commerce Committee. The committee is tasked with finding $880 billion in savings over the next 10 years. Under the newly released bill, more than $700 billion of that would come from Medicaid. Here's what would change. Recipients who are able-bodied and have no dependents would have to prove they are working, volunteering, or in school 80 hours a month to receive coverage. Those who make more than 100% of the federal poverty level, or about $32,000 a year for a family of 4, would be required to pay some out-of-pocket costs. States would have to verify all enrollees' eligibility twice a year, and that includes proof of citizenship. Those that provide Medicaid for non-citizens, like Colorado, would see federal funding cut by 10%. States would also have to scrub their rolls for people enrolled in multiple Medicaid programs. Republicans say more than 1 million people are covered in more than one state. The GOP insists Medicaid will continue to grow 25% a year under their plan and that they are simply slowing the growth. Democrats say initial analysis shows more than 8 million people will lose coverage.
It's kind of an alternative reality if Republicans are going to say we're going to cut more than $700 billion from Medicaid, but we're not going to cut anybody off of Medicaid. That's not true. And if they really think that, they're lying to themselves. But what's worse, they're lying to their constituents who are going to lose their Medicaid coverage.
If you are a lawful beneficiary of Medicaid, then the program is going to still continue to function and work for you. And it will probably actually work better because by cutting out this fraud, waste, and abuse, our providers and the system itself will be more efficient so that we can get care to the people that actually rely on it better and faster.
The Colorado Department of Healthcare Policy and Finance, which administers Medicaid, says the work requirements alone could impact nearly 380,000 Coloradans, and the administrative costs could run more than $57 million. The Energy and Commerce Committee will begin debating the bill tomorrow. And in addition to Democrats, many moderate Republicans are also worried about the impacts to Medicaid. Any changes wouldn't take place until 2029. So, in other words, this is a first step.
Yeah.
Right. You know, we are going to see changes to this bill through the process.
And certainly something a lot of people are going to be watching as this continues to evolve.
It affects a lot of people.
Yeah.
Right.
Thank you.